Hello, and welcome to NCLEX Made Easy 91. This Christmas season, we're unwrapping high-yield NCLEX gastrointestinal questions designed to sharpen your critical thinking and boost your exam confidence. Grab your notebook, stay focused, and let's make this your season of success. Let's get started.
Question 1. A client with acute pancreatitis reports severe epigastric pain radiating to the back. Priority nursing action. A. Administer oral analgesics. B. Encourage deep breathing. C. Keep the client NPO. D. Apply a heating pad. Correct answer, C. Keep the client NPO. Rationale. Pancreatic stimulation worsens inflammation, NPO status reduces enzyme secretion. Strategy. Reduce organ stimulation in acute inflammation. Question 2. A client with suspected bowel obstruction presents with abdominal distension and vomiting. Priority nursing action. A. Encourage oral fluids. B. Insert a nasogastric tube. C. Administer laxatives. D. Place client in prone position. Correct answer, B. Insert a nasogastric tube. Rationale. NG decompression prevents aspiration and relieves pressure. Strategy. Decompression first in obstruction. Question 3. Which assessment finding is most concerning in a client with GI bleeding? A. Black tarry stools. B. Fatigue. C. Hypotension and tachycardia. D. Abdominal cramping. Correct answer, C. Hypotension and tachycardia. Rationale. Indicates hypovolemic shock from blood loss. Strategy. ABCs, circulation takes priority. Question 4. A client with liver cirrhosis develops confusion and hysterexis. Priority intervention. A. Increase protein intake. B. Administer lactulose. C. Encourage ambulation. D. Restrict fluids. Correct answer, B. Administer lactulose. Rationale. Lactulose lowers ammonia levels causing hepatic encephalopathy. Strategy. Treat cause of altered mental status. Question 5. Which stool characteristic suggests upper GI bleeding? A. Bright red blood. B. Clay-colored stool. C. Melena. D. Mucus-filled stool. Correct answer, C. Melena. Rationale. Digested blood appears black and tarry. Strategy. Location-based symptom recognition. Question 6. A client with Crohn's disease is most at risk for which complication? A. Toxic megacolon. B. Intestinal strictures. C. Hemorrhoids. D. Gastritis. Correct answer, B. Intestinal strictures. Rationale. Transmural inflammation leads to fibrosis and narrowing. Strategy. Match pathology to disease depth. Question 7. Which diet is appropriate for acute diverticulitis? A. High-fiber diet. B. Clear liquid diet. C. High-protein diet. D. Regular diet. Correct answer, B. Clear liquid diet. Rationale. Allows bowel rest during acute inflammation. Strategy. Rest inflamed GI tract. Question 8. A client post-gastrectomy reports dizziness and palpitations after meals. Cause? A. GERD. B. Dumping syndrome. C. Peptic ulcer disease. D. Bowel obstruction. Correct answer, B. Dumping syndrome. Rationale. Rapid gastric emptying causes fluid shifts and hypoglycemia. Strategy. Recognize post-meal symptoms. Question 9. Which lab finding is expected in chronic liver disease? A. Increased albumin. B. Decreased ammonia. C. Prolonged PT/INR. D. Increased platelets. Correct answer, C. Prolonged PT/INR. Rationale. Liver cannot synthesize clotting factors. Strategy. Link labs to liver function. Question 10. A client with peptic ulcer disease should avoid which medication? A. Acetaminophen. B. Antacids. C. Ibuprofen. D. Proton pump inhibitors. Correct answer, C. Ibuprofen. Rationale, NSAIDs increase gastric mucosal injury. Strategy, avoid gastric irritants. Question 11. Priority assessment in a client with suspected appendicitis. A. Rebound tenderness. B. Bowel sounds. C. Pain location. D. Temperature. Correct answer, C. Pain location. Rationale, RLQ pain is a key diagnostic indicator. Strategy, focused assessment for classic signs. Question 12. Which finding suggests paralytic ileus? A. High-pitched bowel sounds. B. Absent bowel sounds. C. Severe diarrhea. D. Bloody stools. Correct answer, B. Absent bowel sounds. Rationale, ileus causes cessation of peristalsis. Strategy, listen before you act. Question 13. A client with ulcerative colitis is at highest risk for A. Colon cancer. B. Gallstones. C. Pancreatitis. D. GERD. Correct answer, A. Colon cancer. Rationale, chronic inflammation increases malignancy risk. Strategy, long-term complication awareness. Question 14. Best position to reduce reflux symptoms. A. Supine. B. Left lateral. C. Semi-Fowler's. D. Prone. Correct answer, C. Semi-Fowler's. Rationale, elevation reduces gastric reflux. Strategy, gravity-assisted interventions. Question 15. A client with hepatitis A requires which isolation? A. Airborne. B. Droplet. C. Contact. D. Standard precautions. Correct answer, D. Standard precautions. Rationale, hepatitis A spreads fecal-orally, hand hygiene is key. Strategy, transmission-based reasoning. Question 16. Which sign indicates worsening cirrhosis? A. Jaundice. B. Ascites. C. Spider angiomas. D. Hematemesis. Correct answer, D. Hematemesis. Rationale, indicates esophageal variceal bleeding, life-threatening. Strategy, identify emergency complications. Question 17. A client with NG tube suctioning is at risk for A. Metabolic acidosis. B. Metabolic alkalosis. C. Hyperkalemia. D. Hypernatremia. Correct answer, B. Metabolic alkalosis. Rationale, loss of gastric acid increases pH. Strategy, link GI losses to acid-base balance. Question 18. Which symptom is classic for gallbladder disease? A. RLQ pain. B. LLQ pain. C. RUQ pain after fatty meals. D. Epigastric pain relieved by food. Correct answer, C. RUQ pain after fatty meals. Rationale, fat digestion stimulates gallbladder contraction. Strategy, symptom-food relationship. Question 19. Priority nursing action for esophageal varices. A. Administer antiemetics. B. Avoid NG tube insertion. C. Encourage coughing. D. Increase oral fluids. Correct answer, B. Avoid NG tube insertion. Rationale, NG tubes can rupture varices causing hemorrhage. Strategy, prevent catastrophic bleeding. Question 20. A client with diarrhea is most at risk for A. Hypertension. B. Fluid volume deficit. C. Hypercalcemia. D. Bradycardia. Correct answer, B. Fluid volume deficit. Rationale, excess fluid loss leads to dehydration. Strategy, anticipate common complications. Question 21. Best indicator of adequate nutrition in a client with GI disease. A. Weight gain. B. Appetite. C. Albumin level. D. Hemoglobin. Correct answer, C. Albumin level. Rationale, reflects long-term nutritional status. Strategy, use objective labs. Question 22. Which finding suggests peritonitis? A. Soft abdomen. B. Guarding and rigidity. C. Increased appetite. D. Hyperactive bowel sounds. Correct answer, B. Guarding and rigidity. Rationale: inflammation causes abdominal muscle tightening. Strategy: identify surgical emergencies. Question 23. Priority care after abdominal surgery. A. Early ambulation. B. Pain control. C. Incentive spirometry. D. Monitor bowel sounds. Correct answer, C. Incentive spirometry. Rationale: prevents postoperative atelectasis. Strategy: airway before mobility. Question 24. A client with IBS should be taught to A. Avoid all fiber. B. Identify trigger foods. C. Restrict fluids. D. Use laxatives daily. Correct answer, B. Identify trigger foods. Rationale: symptoms vary by diet and stress. Strategy: individualized management. Question 25. Which medication treats GERD by reducing acid secretion? A. Sucralfate. B. Aluminum hydroxide. C. Omeprazole. D. Metoclopramide. Correct answer, C. Omeprazole. Rationale: proton pump inhibitors suppress gastric acid production. Strategy: match drug class to action. Question 26. A client with ascites should be positioned A. Supine. B. Trendelenburg. C. High Fowlers. D. Prone. Correct answer, C. High Fowlers. Rationale: improves breathing by reducing diaphragmatic pressure. Strategy: optimize ventilation. Question 27. Which vitamin deficiency is common in liver disease? A. Vitamin C. B. Vitamin B12. C. Vitamin K. D. Vitamin A. Correct answer, C. Vitamin K. Rationale: liver synthesizes clotting factors dependent on vitamin K. Strategy: connect liver to coagulation. Question 28. Best indicator of worsening pancreatitis. A. Decreasing pain. B. Hypocalcemia. C. Improved appetite. D. Normal lipase. Correct answer, B. Hypocalcemia. Rationale: fat necrosis binds calcium. Strategy: monitor critical labs. Question 29. A client with ostomy care should be taught to A. Change appliance daily. B. Clean skin with alcohol. C. Measure stoma size regularly. D. Restrict fluids. Correct answer, C. Measure stoma size regularly. Rationale: stoma size changes postoperatively. Strategy: prevent skin breakdown. Question 30. Which sign suggests bowel perforation? A. Gradual pain relief. B. Sudden severe abdominal pain. C. Increased bowel sounds. D. Flatulence. Correct answer, B. Sudden severe abdominal pain. Rationale: perforation causes acute peritonitis. Strategy: emergency recognition. Question 31. A client with hemorrhoids should be advised to A. Strain during defecation. B. Increase fiber intake. C. Limit fluid intake. D. Avoid sitz baths. Correct answer, B. Increase fiber intake. Rationale: prevents constipation and straining. Strategy: reduce causative factors. Question 32. Which condition causes clay-colored stools? A. Pancreatitis. B. Hepatitis. C. Gallbladder obstruction. D. Peptic ulcer disease. Correct answer, C. Gallbladder obstruction. Rationale: lack of bile pigments lightens stool color. Strategy: bile flow association. Question 33. Priority lab to monitor in severe diarrhea. A. Sodium. B. Calcium. C. Potassium. D. Magnesium. Correct answer, C. Potassium. Rationale: GI losses cause hypokalemia. Strategy, monitor life-threatening electrolytes. Question 34. Which symptom indicates upper GI irritation? A. Hematochezia. B. Coffee ground emesis. C. Tenesmus. D. Mucus in stool. Correct answer, B. Coffee ground emesis. Rationale, indicates partially digested blood. Strategy, differentiate GI bleed location. Question 35. A client with C. difficile infection requires A. Droplet isolation. B. Airborne isolation. C. Contact precautions. D. Standard precautions only. Correct answer, C. Contact precautions. Rationale, spores spread via contact. Strategy, infection control priority. Question 36. Which food should be avoided with GERD? A. Oatmeal. B. Bananas. C. Chocolate. D. Lean chicken. Correct answer, C. Chocolate. Rationale, relaxes lower esophageal sphincter. Strategy, identify trigger foods. Question 37. A client post-liver biopsy should be positioned. A. Supine. B. Right side lying. C. Left side lying. D. High Fowler's. Correct answer, B. Right side lying. Rationale, reduces bleeding at biopsy site. Strategy, prevent hemorrhage. Question 38. Which condition is characterized by skip lesions? A. Ulcerative colitis. B. IBS. C. Crohn's disease. D. Diverticulosis. Correct answer, C. Crohn's disease. Rationale, inflammation occurs in patches. Strategy, disease pattern recognition. Question 39. A client with GI bleeding should avoid which activity? A. Bed rest. B. Valsalva maneuver. C. Oxygen therapy. D. For fluids. Correct answer, B. Valsalva maneuver. Rationale, increases pressure and bleeding risk. Strategy, prevent strain. Question 40. Which assessment indicates dehydration? A. Bounding pulse. B. Dry mucous membranes. C. Increased urine output. D. Weight gain. Correct answer, B. Dry mucous membranes. Rationale, indicates fluid deficit. Strategy, clinical signs first. Question 41. Best diet for chronic constipation. A. Low residue. B. High protein. C. High fiber. D. Liquid diet. Correct answer, C. High fiber. Rationale, promotes stool bulk and motility. Strategy, dietary management. Question 42. A client with pancreatitis should avoid A. Carbohydrates. B. Fatty foods. C. Fluids. D. Protein. Correct answer, B. Fatty foods. Rationale, fat stimulates pancreatic enzymes. Strategy, reduce organ workload. Question 43. Which finding is most concerning post-abdominal surgery? A. Pain score 6 out of 10. B. No bowel sounds at 8 hours. C. Fever and rigid abdomen. D. Mild nausea. Correct answer, C. Fever and rigid abdomen. Rationale, suggests peritonitis or infection. Strategy, identify red flags. Question 44. A client with GERD should be taught to A. Eat late-night meals. B. Lie flat after eating. C. Elevate head of bed. D. Drink carbonated beverages. Correct answer, C. Elevate head of bed. Rationale, reduces reflux. Strategy, lifestyle modification. Question 45. Which medication protects gastric mucosa? A. Omeprazole. B. Sucralfate. C. Ranitidine. D. Metronidazole. Correct answer, B. Sucralfate. Rationale, coats ulcer sites. Strategy, drug mechanism identification. Question 46. Priority care for vomiting client. A. Oral rehydration immediately. B. Assess airway. C. Administer laxatives. D. Encourage ambulation. Correct answer, B. Assess airway. Rationale, risk for aspiration. Strategy, ABCs first. Question 47. A client with ulcerative colitis differs from Crohn's by having A. Transmural inflammation. B. Skip lesions. C. Continuous lesions. D. Small intestine involvement. Correct answer, C. Continuous lesions. Rationale, UC affects colon continuously. Strategy, compare disease patterns. Question 48. Which lab is elevated in acute pancreatitis? A. AST. B. Amylase. C. Bilirubin. D. Albumin. Correct answer, B. Amylase. Rationale, released from inflamed pancreas. Strategy, match labs to organs. Question 49. Best indicator of effective treatment for diarrhea. A. Reduced bowel sounds. B. Normal electrolytes. C. Increased appetite. D. Weight loss. Correct answer, B. Normal electrolytes. Rationale, reflects restored balance. Strategy, objective outcomes. Question 50. A client with suspected GI perforation requires A. Oral antibiotics. B. Immediate surgery. C. High-fiber diet. D. Stool softeners. Correct answer, B. Immediate surgery. Rationale, prevents sepsis and peritonitis. Strategy, surgical emergency recognition.
That brings us to the end of today's NCLEX Gastrointestinal High-Yield Questions on NCLEX Made Easy 91. Consistent practice is key to mastering NCLEX-style thinking, so review the rationales, understand the strategies, and apply them to similar questions. If this video helped you, please like, share, and subscribe for more high-yield NCLEX content. Thank you for watching, and see you in the next review session.